Good afternoon, everyone. This is Jen Smith, Deputy Secretary for the Office of Mental Health and Substance Abuse Services within the Pennsylvania Department of Human Services. If you are tuning in for our October Stakeholder webinar, you are in the right place. Thank you so much for joining us today. I want to take care of just a few housekeeping items before we get started. So if we could flip to the next slide. I just wanted to remind folks that the use of AI bots or any transcription tools are not permitted by the Commonwealth. So if we note any of those kinds of things trying to enter the meeting, we likely will kick them out of the meeting. If you need to turn something off on your end to ensure that those pieces of technology don't attempt to join the meeting, you can feel free to do that. But that's just a reminder that we don't permit that happening. We are recording this session, however, so again, a reminder that if you choose not to be recorded as part of this presentation, now is the time to hop off before we proceed with the rest of the session. If we turn to the next slide, please. This webinar is set up for attendees to be in a listen-only mode status, which means you will not be able to unmute yourself. However, we do want your feedback and we do want your engagement during the session. So the way to do that is if you look at the upper right-hand corner of your screen, likely, you'll see a little box that has a question mark in it. If you're looking at the screen right now, there's a red arrow showing you which button I'm talking about. When you click on that button, a box will appear that allows you to type a question. So if at any point in the presentation you have questions, please make sure that you are using that feature, the one with the question mark in it. I know there's one right next to it that also looks inviting, but that is the chat feature. That is not the feature we want you to use. So look for the one with the question mark. Also, a reminder that we have a resource account available for folks who have particular agenda items that they would like us to cover in future stakeholder webinars. So you see that there on your screen. It is ra-omsas correspond@pa.gov. We'll take suggestions at any time, so feel free to utilize that. Today's agenda looks relatively short, but we do have a number of items to cover with you today. I'm going to start things off with introductions of a couple new key staff members here at OMHSAS. I will give a relatively short state budget update. I wish I had more to share. Then Jill Stempel's going to provide some updates related to our regulatory work. And I'll finish things off today with an update on the SR settlement agreement that many of you have been hearing about. So that's the agenda for today. I'm going to get things started first with two important introductions of new key staff members here at the Office of Mental Health and Substance Abuse Services. First, I'm going to take the opportunity to introduce to you Paul Minnick. Paul is our Bureau Director for Community and Hospital Operations. He is in the position now that formerly Phil Mader had occupied, if you're familiar with that name. And Paul is responsible for overseeing the functions within our office that oversee all of our 7 facilities, so our 6 state hospitals, as well as South Mountain Restoration Center, as well as having some oversight of our community operations section. So I'd like to turn it over to Paul for him to introduce himself to all of you. Paul?
Jen, thanks so much for that introduction. Thank you all. As Jen said, my name is Paul Minnick. I'm a registered nurse by training. My clinical specialty was psychiatric nursing, but have spent the last probably 3 decades in acute care medical surgical hospitals, and leaving my last position as hospital president for 2 hospitals in southern New Jersey. So most of my career has been spent in the Philadelphia area. I have a particular interest in quality and risk. My doctorate studies from Villanova are around high reliability. So it's definitely quite an interest for me. Feel very fortunate to be a member of our Deputy Secretary's team and continuing the great work that's happened across the state within behavioral health. So thanks so much for the opportunity to meet everyone.
Thanks, Paul. Really appreciate you hopping on today and letting people hear a little bit about you. And then the second individual that I'd like to introduce is only 3 weeks into her stint in the office here, and that is Dr. Julie Graziani. Julie is the new Chief Psychiatric Officer. We also refer to her as the Medical Director here at OMHSAS. She has taken the position that was formerly held for many, many years by Dr. Dale Adair. And so I'm going to let Julie tell you all a little bit about herself and where she's coming to us from. Julie?
Hi, Jen, thank you for the introduction. I'm very excited to be at OMHSAS. Like Deputy Secretary Smith said, I am 3 weeks in. I have a background in geriatric psychiatry, having done a fellowship at UPMC out in Pittsburgh, and then I stayed and practiced there for a few years. And then I moved to the Harrisburg region, and I most recently was an inpatient psychiatrist at PPI in Harrisburg. So I'm very excited to be here and to work with the OMHSAS team. So thank you.
Thanks, Julie. I'm really excited to have a medical director again here at the office. Even though we're sad to have seen Dr. Adair leave, very excited for Julie's experience and expertise and sort of a fresh perspective to some of the work that we've been doing. So really glad to have 2 new, highly motivated and highly qualified staff joining our team. I also wanted to just take a moment before we dive into the budget update to just express a word of thanks to all of you as stakeholders, whether you are individuals working in the county, whether you're with a provider organization, part of an association, a person or a family member with lived experience. Maybe you're just a person from the general public who saw this link and thought it would be a good use of your Thursday afternoon. Whatever capacity you're joining us in, I really appreciate that you're taking the time. I know that things have been pretty difficult for the behavioral health system and beyond, but specifically our system. And there's a lot of uncertainty around what a state budget impasse and a federal budget impasse mean. A lot of questions around policy decisions that are happening at local, state, and federal levels and what that means to our system. And I think just a lot of overall concern that Pennsylvanians may not be able to access the services that they really need. And it is thanks to all of you that I know we will navigate all of those challenges to the very best of our ability. I was working in the behavioral health system when the COVID-19 pandemic hit. And while it was a really wild time for a little while there, it really did give me such a sense of hope in our ability as a system to come together, to address challenges head on, to come up with creative solutions, and to keep the people we serve at the forefront of everything we were doing. And I kind of feel like we're headed into a very similar time where we're going to have to make difficult decisions, where the funding and resources to support our system probably are not sufficient. And that's going to lead us to have to work together and work in creative ways that maybe we haven't previously had to do. So I'm just really thankful for all of you. I hope that you convey that message of thanks to your colleagues and to your employees and to the people in your life that also help support the behavioral health system. And I hope you feel a sense of community here, that we really are all in this together with a shared mission of ensuring that not only our system stays intact, but that we're able to make the most of the situation and make really good decisions to provide the best possible care that we can during this time. So just wanted to make sure that I expressed that heartfelt thanks to all of you. That being said, from a state budget perspective, I don't have any exciting information or insider knowledge about when we can expect a state budget. I know that negotiations continue. I know that there are still a number of issues that the General Assembly is trying to work through and to come up with some compromises for. So until we have an official approved passed budget, there's really not much I can speculate about in terms of how that will impact behavioral health. What I can do is remind you that Governor Shapiro had proposed a number of investments in his 25-26 fiscal year budget proposal. He proposed, again, a $20 million increase to base funds. He proposed some unique funding to support 988 and crisis services. Again, anher investment for mental health services within schools, and some investment in our CHIPS program. So, I mean, what I can say is that there is a commitment on the part of the Shapiro administration to ensure that behavioral health services continue and are expanded to the extent that they can be. I can't speculate as to what that will translate to in terms of the numbers and what will come through in the budget. I will say, as soon as we know something, as soon as we see those numbers, we will do our best to communicate that out, especially to those that are most directly impacted. So our county human service administrators and mental health administrators, they're going to hear about things very quickly. We will communicate with our primary contractors and managed care organizations as quickly as we can. And if there's anything worthy of pushing out through a broader listserv message, we will do that as well. So if you hear on the news that it sounds like a budget deal is happening, just keep your ears perked up, and we'll do our best to communicate whatever information we have as quickly as we can. I'm going to quickly check the questions here. Okay, I don't see anything coming in just yet. So I am going to move on to our next agenda item, and I'm going to turn the floor over to Jill Stemple, who is the Bureau Director for Policy Planning and Program Development, to provide an update on our regulatory work. And if we could advance the slide while Jill's getting started, that would be great.
Thank you, Jen. Sam, are you able to move the slide one forward? Okay, there we go. Great. There's not that much detail on here anyway, but just so you can follow along a little bit. So two regulation packages that I wanted to talk to you all about today to update you. The package that you have been hearing about probably the longest and the most for OMHSAS, our crisis licensing regulations. We are thrilled to announce are currently up for public comment. They are posted on the Independent Regulatory Review Commission's website now. And that announcement did go out through the OMHSAS listserv as well, so you may have seen it there, but if anyone needs the link, we can certainly get that to you. They will be open for public comment through November 17th. And for folks who aren't aware of our regulatory process in Pennsylvania, it is a two-step process in which we take a proposed package out for public comment. We will receive those comments back, and we will spend the next couple of months taking those comments into account as we draft a final form regulation that has to be presented to the Independent Regulatory Review Commission no later than 2 years from November 17th of 2025. So these regulations are not final. We base them very heavily on the SAMHSA toolkit for crisis, trying to get our system in line with national best practices. But this is very much a real public comment period. This is not performative. We want to hear from all of you on how we can strike a balance between those federal best practices that SAMHSA is putting out and what will work here in Pennsylvania. So we value your input, and we really would encourage you to put comments in if you have them to help us make those better and make sure the final form regulations work here in Pennsylvania. The other thing I do just want to note about those public comments, by statute, we have to publish every comment that we receive with the name attached on the IRC website. So we are thrilled to receive comments from folks with lived experience, but please make sure anything you're putting in those comments, you're comfortable being put on a website with your name on it. There is a second crisis package that is still working its way through the review process. The crisis licensing that is up for public comment now is for any crisis provider who is operating in the state of Pennsylvania. The package that is following behind is our Medicaid payment regulations, and that is only specific to providers who are seeking payment through the Medicaid system. And we expect that portion of the overall crisis package will be out in 2026 for review. The other package that we're currently working on, the 5100 confidentiality regs, will also be going out for public comment later this year. We are working on confirming that date, but we expect it will likely be in December. This package is looking to update our regs to align them with HIPAA requirements. So this is not a major change in practice for the field. Really, we're just aligning with what you're all already doing, but hopefully making our regs a little bit more readable and easy to use, because they will no longer have information in them that contradict HIPAA requirements that already take precedent. We're really excited to have these reg packages moving forward. As anyone who's done any work on regs knows, it is a huge and heavy lift. So a giant shout out to my team who did a ton of work to get these packages here. And we're really excited to be at this step where we get to hear from all of you.
Great, thank you, Jill. We had one comment or a question, excuse me, Jill. What's the time frame after the public comment ends? Boy, that's a little bit of a loaded question, isn't it?
Yeah. So by statute, we have to be back at the IRC with a final form package by November 17th of 2027. What happens in those 2 years is a lot of that internal processing of comments, reworking the package, and then a lengthy review process of going through DHS review, Gov's office review, etc. So that's hard to nail down in specifics, but that's essentially what we're doing for the next 2 years on the package post public comment.
And maybe less than 2 years, right? I mean, that's
Hopefully
kind of the end date. We have to have it done by then, but
yeah.
Certainly if it is ready sooner than that, the process can happen sooner than that.
Absolutely, it can. Yeah, the crisis regs will look to keep close together. So we will try to be taking both the payment and the licensing regs to the IRC in fairly close succession. So that will inform some of that timing. And then the 5100 regulations, we're not thinking those will need a whole lot of changes between proposed and final form. So those will almost certainly go faster than 2 years.
One last question, Jill, for you, and then we've got a couple questions about PRTF. The last one for you was when in 2026 are the payment regulations expected?
So I don't want to give an exact time frame because it's a little bit out of our hands. As we talked about when the crisis licensing regs were in that process, we have to get them approved by the department, by the governor's office, and by the attorney general's office. And all of those folks essentially get to take the time that they need. So we are hoping that it will be out for public comment in the first half of 2026, but I can't promise that date to anyone.
Thanks, Jill. There were a couple questions in the chat about PRTF regulations. I'll try to answer it, but I do believe that Scott Talley, our Children's Bureau Director, is on as well, so he can correct anything that I state incorrectly or add to anything. The status of the PRTF regs at this point is those had gone through that first review process and were published on the Independent Regulatory Review Commission, or IRC's, website for public comment. We received a lot of public comment. We have gone through the process of responding to all of those. We hosted then a series of different webinars and individualized meetings and outreaches to clarify some of the questions and comments that had come in. And now we are in the process of fine-tuning any adjustments to those regulations based on what we heard during the public comment period or in the meetings that followed. So what will happen next with those is they will then begin their journey back through that review process, ultimately ending up at IRC for a second time, where there will be a public hearing scheduled. We will be at the hearing to answer any questions the IRC commissioners have about those regulations and for them to hear any public comment on it. And then they will take a vote in terms of whether the regulations are promulgated. So, Scott, did I miss anything on that one?
No, the only thing I would add is that we've been on the clock for almost a year. So we will have to have ours completed and have the IRC meeting by the end of November of next year of 2026.
Good, thanks, Scott. I saw one more question come in. Jill, this is around the 4 walls issue and what the update is around that. Would you like to take that question?
Sure. So the 4 walls is unfortunately in the same place it was the last stakeholder meeting that we met. We are still waiting on House Bill 1590 to move in the Senate. If that is important to you as stakeholders, we would certainly encourage you to call your senators and let them know that. So hopefully the next time we're on this call, that's not still the same update. But we are still prepped and ready to go when that is operationalized. We will plan to get a bulletin out literally the week that happens. So as soon as we know something, you will know something for sure.
Thanks, Jill. And then a question from Tori Bright about a Q&A session for the involuntary commitment bulletin.
Sure. So we did receive the comments back from the field on the update to the Mental Health Procedures Act forms. Based on those comments, we are looking to make some changes to the involuntary commitment form. That will be going out to our counties for advanced review. I had hoped it would already been out, but unfortunately I got delayed with a few other priorities. So it will be out to them soon for an advanced review. And then it will be published as a final update. And then once we have that timeline, we will schedule the Q&A session. But since it's still working its way through that revision process, I don't have a date for that yet, but it will be before the new bulletin goes into effect so that you have time to adjust in the field.
Thank you, Jill. And I thought we were done, Jill, but there's one more question that came in about the crisis payment regulations, looking for some additional information about why that might be necessary or why it's different from how crisis payments are currently made.
Yeah, so our licensing regs and payment regs should always be separate. I will say that's not maybe historically how OMHSAS has always done it, but that is the direction we are going because those are 2 different standards. Our licensing regs are about setting health and safety minimum standards for services for anyone who wants to offer those services in Pennsylvania, regardless of who's paying for them. The Medicaid payment regulations are making sure that we are staying in compliance with both state and federal Medicaid requirements, and that it is a good use of the taxpayer dollars and how we're spending those funds. So those are 2 different standards, and we do have to do that as 2 different sets of regulations. So that's kind of the high level. But if there's more specific questions, happy to dig into that.
Thanks, Jill. There is someone in the questions that asked to repeat what was said about involuntary commitment. I'm going to ask you instead, Jill, if you would mind just typing a response to that one so that we're not spending time
Sure.
repeating the answer. This session is being recorded, by the way, so if anyone needs to go back and listen, the link will be available to you to do that as well. Okay, if we could move to the next slide, we're going to take ourselves back to the original agenda. I do see a question in the chat from Diane about my perspective on issues preventing a passed budget. I really don't want to speculate on that. I have not been part of budget negotiations. I'm sure that's shocking to all of you, but I have not been part of those conversations. I've heard lots of rumors around what the sticking points are and which topics those center around, but I really don't know how reliable any of that information is because I'm not hearing it directly from the source. So I would really hesitate to offer any speculation on what the sticking points are. So I apologize that I don't have a good answer for that one. Okay, great discussion, great questions. I'm going to shift us into the last agenda item for today, which is around the SR settlement. If this doesn't mean anything to you, that's okay. I'm going to share a little bit of background now about what that means. So SR are the initials of an individual. So it's not an acronym that stands for a particular government term, believe it or not. They are the initials of an individual. And this is related to a class action suit that was filed against the Department of Human Services by Disability Rights Pennsylvania, DRP, back in December of 2017. And the plaintiffs in the case were 6 medical assistance beneficiaries who were all under the age of 21 and had been adjudicated dependent and had behavioral health diagnoses. And it has taken since December of 2017 for both parties to reach an acceptable settlement agreement. And so back in June, DRP and the Department of Human Services reached that agreement between the two of our parties. We formalized that into a document, and a judge was able to review that and sign off on it on October 1st, which kind of effectuated the formality of that settlement agreement. So when you read the terms in the settlement agreement, it'll say within 180 days or, within 90 days, that clock starts ticking October 1st because that was the date that the judge signed off on the agreement. The allegations within the litigation itself was centered around allegations that the Department of Human Services failed to protect these children, these 6 individuals, from various forms of discrimination, including unnecessary institutionalization. So a lot of our discussions kind of focused around the idea that both the plaintiffs and the Department of Human Services really do agree that these class members, so individuals under 21 who are deemed dependent and have behavioral health diagnoses, that they need access to medically necessary care and that they are really best served in community settings rather than institutions. And that was sort of the premise of the discussions around reaching a settlement for this particular lawsuit. And we kept that as the North Star beacon when we were trying to determine how the Department of Human Services could make the system better and help ensure that those class members do in fact have the best possible access to services that can serve them the best. So ultimately, a number of the terms in the agreement were ways of promoting collaborations that are already happening and coordination of efforts already happening across various parts of human services in terms of addressing dependent children with disabilities. So a number of the items agreed to in that settlement were developed in the context of initiatives that are already underway. So, for example, probably many of you have heard about the work that's been happening around complex needs planning and the blueprint work group that we had established. So there are some things in the settlement agreement that build upon that great work that's already happening with the blueprint work group. So, I think it's important to kind of view this as all of these components of the agreement working together along with current initiatives that we already had underway to help strengthen and continue to address the needs of children with mental health disabilities, especially those that are involved in the child welfare system. So wanted to give a little bit of that background for you. The settlement agreement itself has some key sections that make up its terms. And I'm just going to kind of list some of those key sections to give you an idea. There's a section on mental health screenings and evaluations, teaming models, the complex needs planning process, enhancements to Medicaid and child welfare services, policies and procedures related to RTFs, and then an entire section around identifying and addressing barriers to child welfare and mental health services for class members specifically. So I'll give you a couple examples of some things that the department will be responsible for as part of these settlement terms. For example, we are to issue written guidance encouraging our county children and youth agencies to use evidence-based teaming models. And so there will be some information contained in that guidance about what that means and how they can access those things. Another term is to revise and clarify the bulletin that we have on the complex needs planning process. So we're already working on that. That is an effort underway out of the work happening under Jonathan McVeigh in the Secretary's office in close collaboration with the Office of Children, Youth, and Families, or OCYF, and OMHSAS. Another is to form a complex needs planning team, and it has very specific representatives about who will participate on that team, and that team will be available to provide technical assistance around licensing and funding, all in means of supporting our county children and youth agencies to assist these class members in navigating the complex case planning process. Another term of the agreement is for OMHSAS to develop a list of behavioral health services that would be available to individuals under the age of 21, so a comprehensive list of what kinds of behavioral health services exist in Pennsylvania. And that list will be published on our website and updated every 6 months. So, some folks on the call are probably going to be part of a group of people that will be consulted in asking to help us validate that list and provide feedback on it. Certainly at any point, if you see something's missing from that list once it's been posted, reach out to us right away and we'll get updates made to that. Another piece of the settlement is around some data collection. efforts. And so there will be revisions made to our health choices agreements in order to collect the necessary information from our behavioral health managed care organizations so that we can take a look at some of that data, mostly centered around these class members, so dependent children eligible for Medicaid with mental health diagnoses in specific settings and levels of care, and just some data to ensure that they are moving out of that level of care as soon as it's appropriate to do so. And then kind of the last biggest piece of the settlement agreement is around the engagement of an independent consultant. At this point, information about that specific consultant will be shared once a contract's been established with them. But they will be responsible for identifying and assisting us with implementing specific recommendations and really tangible actions that will help enhance the service delivery system. That may mean reducing reliance on congregate care. It may mean increasing availability of particular services. It may mean collecting and reporting data in different ways that we haven't been previously, in an effort to kind of more real-time monitor some of these things. So there's also a fairly large section in terms of what that will look like and what that consultant's role will be. In terms of the length of the agreement, or when we've satisfied the agreement itself will terminate 90 days after the consultant has deemed that DHS has achieved substantial compliance. And there are some definitions around what that substantial compliance means. So, you know, it's not likely that this agreement is going to be satisfied in the near future. It will likely take several years in order for us to accomplish all of the deliverables and achieve that substantial compliance. But certainly we'll keep folks updated. There will be some regular reports issued surrounding the progress on this agreement. So we're very, very early. Remember, I said that the judge only signed off on the agreement 22 days ago. So, you know, right now we're kind of in that planning process, developing a project plan, assigning some resources to it, and determining a communication strategy and an engagement with some of our stakeholders to accomplish some of the activities. So there will be much more information shared, especially for those of you that, you know, will be intimately involved with us in meeting some of those objectives. But I wanted to give a really high level, because I know the buzz has been going around. What is this settlement? What's it all about? Where are we with it? So I wanted to make sure that I provided all of that to you. I see one question about sharing a copy of the settlement agreement. So at this stage, I'm not certain that I'm able to do that. Can definitely ask that question. I do know that the proposed settlement agreement had been publicly available back in June, July timeframe, because DRP, as the legal representation for the plaintiff, was required to post it and receive feedback from class members. So I would likely think that you could find it if you Googled it. Someone mentioned, Tori says it's listed on the DRP website. And the judge did not make any alterations to the agreement. It was signed as is. So if you find it out there, nothing has changed. I don't see any other questions floating in at this point.
There is one, Jen, that is there going to be a meeting with OMHSAS and BIMCO's operationalizing.
Oh, thank you. Yes, I
Yeah.
scrolled right over that. My apologies, Megan. Yes. We will be adding this likely as a regular agenda item to some of our existing meetings for now, and likely there will be a specific meeting with primary contractors and BIMCOs to talk about the adjustments to the health choices agreements. So yes, you can expect those conversations in the near future. Thanks, Scott. I'm sorry that I missed that one. Okay, well, I'll take the opportunity. If anyone has any last minute questions, go ahead and type them. In the meantime, I'll remind you that our next stakeholder webinar is scheduled for January 29th of 2026. Can you believe that? Wow, already talking about January. So if you have any agenda topics that you'd like to make sure we include in that January meeting, the resource account listed above on the screen there, ra-omsas correspond@pa.gov, is where you want to send those suggestions to. I'm very hopeful that by the end of January, we'll have an update for you in terms of a state budget and whatever impacts there might be as a result of what gets passed. So everyone keep your fingers crossed for that. One last question I see. If we have questions about regulations, what email address should we use to ask those questions? Jill, would you mind popping that in the response to that question?
Yep, absolutely. I can do that.
Yeah, we have a resource account. That's the best way to ask those kinds of questions so that we don't miss them. Thanks, Jill. All right, I don't see any other questions. So I thank you so much for your time this afternoon. I hope you all stay well, and we'll talk again in January.